Namaskar, I am Dr. Ayan Basu. I am the head of radiation oncology at HCG Cancer Center located in Newtown, Kolkata. In order to address the question of radiotherapy as to how many times it is given, radiotherapy typically can be given for multiple different indications, mainly for palliative purposes where the main objective is to achieve symptom relief in the patient. Short courses of radiotherapy, for example, sometimes a very high dose single fraction treatment or a single treatment, or less than 5 fraction treatments, or sometimes even 10 fraction treatments are given. For most cases where the tumor has been surgically removed, typically radiotherapy would go on for a course of about 30 to 35 treatments, 5 days a week. So that's typically about 1.5 months of radiotherapy. For certain indications where radiotherapy by itself can cure the patient without any surgery, for example for prostate cancer or for cancers of the neck or sometimes cancers of the lower part of the gastrointestinal tract like rectum and anal canal, similarly long course of radiotherapy which lasts about a month or slightly more than that, 5 days a week is employed. The other way of looking at this question is whether radiotherapy can be applied multiple times for the treatment of cancers. Earlier it used to be a challenge because the technology for development of radiotherapy was not of very high accuracy, therefore exposing a lot of normal tissue surrounding the tumor to a high dose of radiation. Presently, the techniques that are employed constitute things like image-guided radiotherapy, intensity-modulated radiotherapy, tomotherapy and so on, where the radiation dose is limited to the tumor and its immediate surrounding areas, thereby protecting the normal tissue surrounding the tumor. Now, as a result of that, if we have a situation where there is a recurrent cancer or a second cancer which has happened in the nearby vicinity of the previous cancer, or the previous cancer has come back and recurred, in many situations there is scope to actually repeat the course of radiation with a curative intent. Of course, the clinician then has to very carefully assess the residual effects of the previous radiotherapy, and generally a sum plan with the previous radiotherapy details and the present plan which is about to be delivered is used to assess what will be the possibility of side effects and whether the patient is going to tolerate a second course of radiotherapy. As a thumb rule, if the patient has had a reasonable gap, even with a high dose of radiotherapy delivered in the first instance, if the tumor has recurred after a length of time, after a gap in time, then it is possible to re-irradiate or repeat the course of radiotherapy with a curative intent.